than 5,100 people have been diagnosed with the coronavirus in North Carolina. Let's take a look at this chart, which shows the number of cases in the triad compared to state numbers. The blue line is our area. There are 549 cases in the Piedmont triad. At least 168 of those patients have recovered, and not every county is reporting the number of people who have beat this disease, so the number of recoveries is likely higher. According to Johns Hopkins University, there are more than 629,000 total confirmed cases of coronavirus nationwide. More than 26,000 patients have died. More than 47,000 have recovered. And this morning, many people want to know when North Carolina will reopen. Governor Cooper is laying out what needs to happen before that's possible. Our Margaret Johnson is working from home. Margaret, what are the three main areas of focus here?
Well, good morning to you, Bria. The three things that you're talking about: testing, tracing, and trends. Here's what the governor says. We need more testing to determine the extent of the virus, more public health workers to trace contacts by infected people, and improve trends in the number of cases, hospitalizations, and deaths. The governor says he wants to get more people back to work, but he says it'll be a slow process. Now, earlier in the week, Governor Cooper said it would be catastrophic to open the state up too soon. Meanwhile, President Trump says some states could begin to ease restrictions by May 1st. Our Kenny Beck spoke with U.S. Senator Thom Tillis about where that fine line might be.
And I think that the governor and the president will be in lockstep when we see data in regions of the state that we may be able to safely open. If we have hot spots, if we're not seeing the trending in the right direction in more populous areas, then we have to take the necessary precautions. What we don't want to do is make the mistake some other countries have. They opened up too soon, and now they're seeing a second peak.
Well, Senator Tillis would not say if he thought early May was too soon for us, but he said North Carolina has not yet hit the peak of that curve that we hear so much about. Governor Cooper says he spoke with some other governors from around the country to see what they were doing to restart businesses. And the state stay-at-home order is in effect until April 30th. Bria, back to you.
Margaret, thank you. The United States is preparing for a new chapter in the coronavirus pandemic. As John Lawrence reports, new federal guidelines are set to be unveiled this afternoon.
President Trump says the U.S. is doing well in the fight against the COVID-19 pandemic.
These encouraging developments have put us in a very strong position to finalize guidelines for states on reopening the country.
The FDA has issued emergency authorization for 2 more antibody tests that could identify people who might be safe to work. However,
with viruses that we deal with all the time, when you develop an antibody after infection, it almost invariably means you're protected. We don't absolutely know that for sure yet.
The White House is expected to give benchmarks on how to ease social distancing, but governors have the final word on when and how they'll move their economies forward.
Let's find out where we are. Let's find out the facts, then we'll make a decision. Everyone has been wrong about everything for this entire duration.
One big city mayor saying Americans might not be able to go to athletic stadiums or arenas until 2021 at the earliest.
We've got many, many miles to walk before we're going to be back in those environments. But I hope we can perhaps watch sporting events without audiences on TV. Of course, listen to concerts as we've been doing.
I'm John Lawrence reporting.
The current federal guidelines for social distancing expire at the end of the month, and they are not expected to be renewed.